All right, so for the 110 nursing drug calculation test, regardless of the campus you're on, all campuses follow the same blueprint and the test is the same. So not this, it's not the same test, but it follows the same format. The format is as follows, and I'm going to open up a separate document here. That way. And then I'll make this document available in the OneDrive shared folder. So you're going to get a 25 question test. And you'll have 1 hour to complete it. You do get to use a calculator, so they'll supply the calculator for you. You don't get to bring in your own. It's a basic 10 key calculator, basically like what you have on your cell phone. And so that is what you can practice using. So when you're doing these practice tests or these practices and things like that, have your calculator available. Like I said, I usually just have my cell phone calculator available. You don't need to have a separate calculator purchased for the class or anything like that. Even if you did, they're not going to give it to you. But it's always a good idea to have a calculator handy. So if you have one, or if you don't have one, go to Walmart, spend $15, get a nice Texas Instrument basic calculator, and that should do you good for the entirety of your nursing program. So 25 question test, you have an hour to complete it, and you are to use a calculator that they will give you. So those are the kind of the basics. The other thing is you essentially get 2 attempts at the test. What constitutes the 2 attempts is you need to pass with a I think it's 92% or greater. Let me just double check my math on that. I guess I should say or better. So you can miss 2 problems out of 25. So 23 divided by 25, yeah, it's a 92%. So you need, if let's say you take it the first time and you do not pass with the 92% or better, you will have to go through remediation. Sometimes that's with me, sometimes that's with the tutor that's on campus, sometimes it's both. It just depends. And then you'll get a retake. And then on the retake, you have to pass again with a 92% or better. If you do not pass with a 92% or better, from what I understand, they'll disenroll you from your classes, your 110 classes, or you'll fail the 110 or the 120, whatever this is applicable to. And then you'll just have to retake it in the spring, from what I understand. So does it happen? Yes, but it's very infrequently, because most students, if not all students, will pass on the second attempt because they'll see what they made or goofed up on the first attempt. The purpose of these review sessions is hopefully to help to reduce the need to worry about having to take this a second time, because it's one extra thing to worry about. So I hope to help mitigate that. All right. So let me go back to the other share here. All right, so there's a blueprint. This blueprint is also available on the OneDrive folder. If you go to the OneDrive folder, click on the Boyce folder, and then inside Boyce, go to 110, you will find a copy of this in there. And it's actually the blueprint for all the classes, and I'll show you that in just a moment. But there are some consistent things that are listed in the blueprint that are important as far as things are concerned. The first thing they always mention is rounding rules. Okay. And we'll talk about that. The second thing is nurses are in the sciences. You're in the biological sciences. whenever you write a number, there should be some sort of a unit associated with that number. What do I mean? That means that you're never going to have 2. It's going to be 2 of what? 2 cups, 2 pints, 2 tablets, 2 capsules, 2 milligrams. You want to always make sure that you are labeling your medications or your dosages depending on what you're looking for. So if you're solving for how many milliliters to administer to a patient, make sure milliliters is in your answer. If it's how many tablets or capsules, make sure tablets or capsules is in your answer. They will mark you wrong just for not having the correct units labeled, even if the math is correct. So there's more to this test than just math by itself. It's, I guess you can just call it proper math for the sciences and the things that you're doing. And think about it from this standpoint, at that front, because sometimes that's something that frustrates students. This is not about punishing you. This is about trying to mitigate errors that can occur in the medical profession, right? Patients to receive 2 what? 2 units, 2 milligrams, 2 grams, 2 kilograms. What are they supposed to be receiving? And you want to, hopefully, if somebody just wrote 2 and they didn't clarify what that was, they would just pause and find out what they're supposed to get. But this is your opportunity to kind of practice and test for that. Zeros. The rules associated with zeros in your answers are as follow. You would only use a leading 0 for doses less than 1. So let's say you had an answer of 0.5 milliliters. The correct way to write that would be 0.5 milliliters. If your answer was 1 milliliter, it would be incorrect to write 0.1 milliliters. Okay. I know sometimes, at least when I say that, it just sounds bizarre to me, but I've seen students write 0.50 milligrams as an answer, and you're like, you don't need that leading 0. Same thing can be said about trailing zeros. Notice that we said 0, the leading 0.5, but we wouldn't want to add a 0 after it. So, and I'll give you some examples of where this happens and why this might happen, but you don't need that lagging 0. So or the trailing 0. So if your answer is 0.5, your answer is 0.5. If your answer is 0.25, your answer is 0.25. All right. All right, rounding. Now, some students get hung up on where it just says milliliters. Rounding can apply to a couple of different things. One of the things that's important to note about rounding is that you can have rounding occur when there is something other than milliliters, and it's a case-by-case issue, and I'll try and show you when and when not to round. But after doing these for a little while with practice, you'll see the times where and how different rounding rules apply. But for the most part, you're dealing with milliliters, and that's where you're going to see a lot of these rounding things take place. And that can include next semester when you start seeing flow rates, milliliters per hour, that sort of thing. All right, so let's look at some of these things. So for rounding, if you have a number, now it does say volumes, but if you have a number greater than 1 milliliter, okay, then you're going to calculate to the 100th place and then round to the nearest 10th. Now, does that mean every single volume that you calculate will have a decimal in it? No, okay, because sometimes you could just get an answer of 10 milliliters. That's it. That's your answer. But let's say you're doing more of like a minute type of medication where it's an injectable, you have a syringe, and you are going to see a calculation of 1.25 milliliters. What you would do is you would look at that number and you would say, okay, it's a number that's greater than 1. I want to round that number to the nearest 10th. In order to round to the nearest 10th, I need to look at the 100th place, which is the 5 in this instance. So following rounding rules, if the number is 5 or greater, then we would round up. If it's 4 or fewer, then we would not round up. Okay. You never round down. So sometimes students will say round down, which I think they just mean to leave it at 1.2. But technically, if you're saying rounding down, that means you're going down a number, and we don't want to do that. So 1.25 milliliters would be rounded to 1.3 milliliters. If it was 1.24 milliliters, then we would not round it up to 1.3. We would leave it at 1.2 milliliters. This is a sticking point. And even though I try my best to go over this every semester that I do this, rounding rules is always a sticking point for students, which is one of the reasons why I don't jump into just doing math. I jump into the things that people are going to miss. What you're going to miss is you're going to forget units, you're going to round incorrectly, or you're going to forget to mark a cup or a syringe or a tubex if it asks you to mark a cup, a syringe, or a tubex. Now, what about volumes less than 1 milliliter? So volumes less than 1 milliliter, we're actually going to take it back a decimal place. We're going to actually, if the answer applies, we're going to take it down to the thousandth place and round to the and then round to the nearest hundredth. The reason we're doing that is because when you get into smaller dosages, you can give somebody a smaller amount. So let's take a look at something like this here. Now, I always say this is a bad example because you're so close to 1 milliliter. You might as well just say 1 milliliter, but if you want to be as precise as possible, following rounding rules is going to be best. And I'll express a caveat to this in just a minute. But so let's say I have 0.969 is my answer after I do it, or it could even be a longer number of digits. I'm going to look at my thousandths place. I'm going to say, is it 5 or more? It is. So I'm going to round up from 0.96 to 0.97. Essentially what we want is we want 2 significant digits if we can get them. Will you have an answer sometimes it's just 0.5? Yes. And then that's your answer. You don't put a lagging 0 on or trailing 0. Just leave it as 0.5. And then the same thing, if I have 0.963, I'm going to look at that 3. It's a number less than 5. So I'm going to leave it at 0.96 milliliters. And again, you'll see this in practice. We'll practice some of these. I'll try and get to a couple practice ones of these today that we can kind of see what that looks like. I'll also show you correct rounding and also when you're not supposed to round. All right. Oh, the other thing I was going to say is, let's say you get like 0.99999. It's 1. Just go ahead and it's 1. You probably had a calculator error. The way you put it into your calculator, the answer is most likely 1. You'll see that sometimes with some of these answers. You'll get like, 29.9999999. It's 30. But we might even see a couple examples of that with some of the things that I'll do today. All right. You need to practice learning military time. So military time, if you're not familiar, is a 24-hour format. So instead of 8 a.m., noon, 8 p.m., midnight, and it's 8:12, 8:12, it's based off of the hour. So like it would be 0800 would be 8 a.m., 2020 or 2000 or 2000 or 2000 hour, 2000 hours is usually how it's described, would be 8 p.m. Then you'd have 1200, it would be 12 p.m. 000 would be 12 a.m. And you'll get some review in that as well if that's something that you are not familiar with. And then the syringes just tell you a little bit more, but believe it or not, I've not seen any test questions that apply to this. The biggest thing I can tell you is like, if you have something that's like the whole syringe is 1 milliliters, most likely it's going to be chopped up into hundredths, if not thousandths. And so you could administer even to the thousandth place. It just depends on, do you have the syringe that measures that way? All right, now the specifics. Remember, I mentioned 25 question test. Your 110 test is going to be based off of a combination of the things listed here in the 110 blueprint. So you're going to have household measurements and converting between systems, between metric and household conversions. What that means is you need to know how to go from cups to milliliters, ounces to milliliters, teaspoons and tablespoons to milliliters, and vice versa. The reason being is because sometimes you are going to do that kind of conversion when you're doing some of these things. So they call them household or imperial measurements. And one of the questions, you'll get some just basic straightforward questions of these conversions, but then you're also going to do it when you do what's called an intake calculation question. The intake calculation question basically is you're converting what the patient consumed liquid wise, and you want to know how much liquids in milliliters they consumed. Then you have metric conversions. Metric conversions can be weight-based conversions. Technically, pounds to kilograms is not a metric conversion. That's a imperial to metric conversion. So that kind of falls in the household measurements thing, but we'll address that shortly. But basically, it's going from grams to milligrams, milligrams to micrograms, milliliters to liters, liters to milliliters, and then interchanging between those units, and knowing how to kind of move your decimal, or what I like to show and what I'll show throughout this class is, or throughout these review sessions, is a technique called dimensional analysis. You do not need to use dimensional analysis to answer your questions. The only reason I mention using that is because it's an easy way for me to write out and show you how I answered a question without just saying I did it in my head, because I don't think that helps you. Me telling you that I can do it doesn't help you learn how to do it. I will oftentimes talk about like ordered over available times quantity as like a shorthand, but essentially I'm doing, and you're doing when you use that, dimensional analysis. You just don't like the word dimensional analysis, you like the formula, but I'll show you that. The reason I'm a big advocate of dimensional analysis is because if you can get and do it, you actually will be able to solve almost any problem without having prior exposure to it, because it's a system that just helps you to arrange your problem in such a way that you're eliminating units you don't want and being left with the units you are looking for. And so before you do any math, you should already be in the units that you're looking for. So I'll try and demonstrate that. You'll have an intake. You'll have two intake questions. The intake questions that you'll typically see for your at Boyce campus is a question where it'll give you a list of foods that the patient received in a hospital setting, and you're going to convert those foods that are typically measured in household measurements and convert them to milliliters. So we'll see some examples of that, and hopefully I've practiced that a little bit before going anywhere else or moving on. Then you'll do a some calculation on oral-based medications. And then when they say one step, that just means it just requires one step to solve. An example of that might be something like, let's say the patient's ordered 500 milligrams of, an antibiotic, and the antibiotic is available at 250 milligrams. And the question would be, how much medication would you administer? So if it's 250 milligrams per capsule, you would give them 2 capsules. So that's what they consider a simple or one-step type problem. Later on, and I don't think it's this semester, but later on, you'll get into like what are called two-step problems. Two-step problems just basically means you might have to convert, micrograms to milligrams or milligrams to micrograms first, then you can solve the medication, or you might have to convert a patient's weight in pounds to kilograms and then multiply by that kilogram to get to the desired dose. So we'll cross those bridges as we get to them. Oral medications include capsules, tablets, but it also includes liquids, right? So suspensions, right? So if you've ever had to do like an oral swish, or if you've ever had to, swallow a medication, then you've done an oral-based medication. Parenteral medications just means that it's going in other than through the mouth. Okay. So it might be, or usually it's going to be an injectable. So it's either going to be intravenous via, they're hooked up to an IV. It could be subcutaneous, or it could be intramuscular. No matter the way that it's administered, the what you're looking for is always the same. It's milliliters, right? Because you can't inject a powder, you can't inject a tablet, you can only inject milliliters. Then we'll do a reconstitution question. This is more of a challenging question in how to read a label. And I'll try and give you some tips and tricks on how to look at and review labels. And then insulin dosages are pretty straightforward. It's just, can you read a sliding scale? Like if the patient's blood sugar reads, 270, and then it says if it's in the range of, 200 to 250, or I'm sorry, 200 to 300, you would give them 3 units of insulin, then that would be your answer. And we'll look at that as well. Or can you add, 2 syringe or 2 insulins together and calculate a total? That's usually just like, can you add 2 numbers together? So, okay. So those are the specifics on, and then, like I said, this is in the OneDrive folder. It should also be in your nursing packet, the dosage calc blueprint. And so my hope is that you can see that, with your, or you'll see that. And if you don't have access to it, like I said, it's on the OneDrive folder. And you could also always email me or contact Miss Petro and find out what those links are. All right. So I do want to just go through a couple and maybe talk a little bit about the household and metric conversions. Before I do that, are there any questions?
I just have a question about the units. Will those be like, is it case sensitive if I write capsules and it's like 1 capsule and I write capsules plural? Is that points off?
Oh, okay. As far as I know, I think you're gonna be okay with that. I would just say, like, just for proper, grammar, just,
Yeah,
capsule is 1, capsules is
of
more than
course.
1. Yeah.
Yeah. Okay.
You should be fine as far as that. I don't think that I've ever seen anyone get something off because they pluralized a singular or vice versa. I think they
Yeah.
just care more so that you actually put the correct thing down. So, like, let's say it was in capsules and you wrote milliliter, then that's the wrong thing. Or
Got it.
it was a tablet and you wrote capsule. I don't even know if they care that much about that, but I would say just follow with what is written on the label.
Yeah, and it's not a drop-down menu of units, right? It's something that you like freely write in.
Correct. Yeah. So
Okay.
this will be pen and paper test or pencil and paper test. I guess I
Okay.
should have added that too. Sometimes, like, they were Blackboard tests for a little while. They might still be Blackboard tests at Allegheny campus, but I think at Boyce it is I think it's a paper test. But even if it is on Blackboard, it's still, they're not going to give you the units. You're going to have to know to
Write it
type it
in.
in.
Okay. That makes sense.
Yeah.
Thank you.
Yeah, good questions. All right, so let me switch back to this other screen here. All right, so the first thing you need to know about the different systems of measurement is there are some things you have to memorize because they will not be provided to you. You won't have a cheat sheet. You won't have like a guide to look at. You have to know what these things are. So I usually tell students, as a good practice, you can create some note cards just to practice these, or just before you sit down to practice like dosage calc, write these things down. Don't just look at them, write them down, practice writing them down. Now, there's a couple things. So I'm actually going to get rid of, this is something that's incorrect information. So if you cook or if you bake, you can confirm a lot of these things and look at your, you can look at them on your different measuring instruments and confirm that these things are universal, and you can see them in your own kitchen. If you have measuring spoons, you will see that 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters. And then we can also make the assumption that if 1 tablespoon is 15 milliliters and 1 teaspoon is 5 milliliters, then 1 tablespoon is also 3 teaspoons. So it also helps out if you're ever trying to do some cooking and you're like, it calls for 3 teaspoons, you can just put in a tablespoon and it's the same thing. An ounce is the same thing as 2 tablespoons or 6 teaspoons or 30 milliliters. So when you look at your like your measuring cup, you can usually see that it converts ounces and milliliters. They're not always exact, and there sometimes is some discrepancy, but the numbers I'm showing you are consistent. A cup is the same thing as 8 ounces, and then that's the same thing as 240 milliliters. So 8 times 30 gives us 240 milliliters. A pint is 2 cups, and that's 480 milliliters. And then a quart is 2 pints, which is 4 cups, which is 32 ounces, which is 960 milliliters. So I didn't put the ounces here, but this would be the same thing as 2 cups is 16 ounces. So actually we'll add that in. Here we go. That way you have an idea of what these things are ounce wise, because sometimes it's helpful just to remember when you see it. Also, the next time you look at a water bottle, or if you have like a, a liter of water or a half liter of water, then you can see like, oh, okay, I see where they wrote in the equivalent in cups or pints or whatever it happens to be. So you need to memorize and you need to learn these things. They will not be given to you. Same thing is going to go for your metric conversions. And I'm going to edit some of these things because this is actually, I think it's 5 questions, and then, but we'll see here. I'll edit these. So a couple things to keep in mind when we're looking at the metric system. So even though this is listed here, but technically the pounds to kilograms or kilograms to pounds is more of a imperial to metric conversion. So this gets lumped in here based off of your blueprint, but in reality, it should actually be up here. So pounds, just like gallons and cups and ounces, are what we use in the imperial system. Household measurements, kilograms is what we would use in the metric system. But the ones that are really important are going to be what are down here. I'm actually going to get rid of this because this is actually confusing. So 1 pound, 16 ounces would be a weight-based thing, but to my knowledge, you won't need to worry about that. So you wouldn't say that's the same thing as milliliters. It's a completely different, it's these ounces up here are fluid ounces. This ounces right here is weight-based ounces. We're going to get rid of that because you won't need to worry about that. Oh, actually, you know what? I can get rid of all these things. Those two. Okay. All right. So you need to know these things, and you have to have them memorized and know how to use them. Grams to milligrams, milligrams to micrograms, liters to milliliters, kilograms to pounds. You really won't need to worry about going from kilograms to grams. And I've also not seen where you've had to go from meters to centimeters to millimeters, but sometimes it's helpful just to see those there. Just in case, but I'm actually going to unbold this bullet point because I don't think I've yet to see that on a test. You might see that when you are doing some like topical like applications, but that's not on your it's not on your blueprint. All right. And then there's also you might have to convert centimeters to inches, but I don't think that's something that you should be doing, but I will I'm sure I'll get feedback on that if that's the case. All right. So you have to learn these. You have to write them out. There's no shorthand. You have to know. You also need to know 60 minutes in an hour. Okay. You need to know those things like it's second nature, that it's not something that's going to be given to you. You have to just know how to use it right off the bat. So let's look at maybe some examples using these things. So I'm just going to skip down and just write up a couple examples, and we'll kind of look at those. So let's say they ask us and they want us to convert from the household measurements to the metric system. So let's say they want to know, I have 6 ounces and I want to know how many milliliters that is. Now, I'll work through this and then we can kind of go through and talk about some other things, and then I'll give you a practice as well. So a couple things you need to remember. First things first. First of all, let me get a color I like here. All right. So you need to first remember that the 1 ounce is the same thing as 30 milliliters. So it's a direct conversion. Okay. So if I'm doing this and I'm doing what is called dimensional analysis, I'm going to take my 6 ounces. That's supposed to be 6OZ. I know that looks like 602, so I apologize. 6 ounces, and I want to convert ounces to milliliters. And I know that 1 ounce is the same thing as 30 milliliters. So 6 ounces, 30 milliliters, 6 times 30, I plug that into my calculator, and my answer is 180 milliliters. So that's how much that would be, what I would put as my answer in here. So let me give you an example to try on your own. Let's say we have 2.5 ounces, and I want to know how many milliliters that is. So go ahead and try that one on your own and just see if we get to the same answer. And then just if you can, just type your answer into the chat. Or since it's just you and me, Kelsey, you can just answer if you got an answer.
I got 75.
And I think that's right. I'm just going to double check. Yeah, good. So this is not meant to be like, yeah, I can do this. This is not a problem. But you always start with the simple. You always start with the basics, and then we build up from there. Okay. So if I'm answering this and I'm doing this and I'm writing this out, dimensional analysis, I'm going to try and simplify this. By the way, you do not need to do what I'm doing. You don't need to write this out like this. But the reason I show you is because sometimes students will ask me, how did you get that? So first of all, what I'm thinking is anytime I see ounces to milliliters, I multiply by 30. That's the shorthand. But I'll show you this as a prompt for later on, because there's certain things where knowing how to do this is helpful. And what is helpful is I can convert or cancel out units and be left with what I'm looking for. And that's how we can get to that same answer, 75. Oh, I think I forgot to. Okay. That's what I was gonna. Give me problems. All right. So let's look at, let's say somebody gave me, 2 cups. And I want to know how many milliliters that is. So some of these we already have because 2 cups is the same thing as 1 pint. And so I can just say, I know that if you remember that 1 cup is 240 milliliters, then you know that 2 cups would be 480 milliliters. If they ask you that. So I think it's not too bad at that point. Let's move into some of the other things that sometimes can create some issues. I'm going to do, let's say, I have 65 milliliters and I want to know, how many, teaspoon or tablespoons that is. So I'll leave it to you, Kelsey. See if you can answer this one before I do it. And it's the I don't know is an acceptable answer.
Yeah, this is where I struggle.
Okay. On God that I asked.
Yes.
So I will start out with writing my conversion. And what I'm trying to do is I'm trying to go from milliliters to tablespoons. Do you remember how many tablespoons are in a milliliter or how many milliliters in a tablespoon?
15 milliliters in a tablespoon.
Good. So before I do any sort of math, before I guess, I know that if I'm going from milliliters to tablespoon, I'm actually going to divide by 15. If I'm going from tablespoons to milliliters, I would multiply by 15. So it's one way to kind of orient that. Or if you set it up like I'm showing you now, at least you know kind of what to do. And then it gives you some clarity. You're going to multiply across the top, 65 times 1, 65, and divide by the bottom. And if I do that, I'm going to get 65 divided by 15, and I'm going to get a number that I was hoping I was going to get. I'm going to get 4.3, and it's just going to keep on going. So if I get a number that looks like that, 4.3 repeating, that is a good indication that you are to follow your rounding rules. If I'm following my rounding rules, we have a number that's greater than 1. So I'm going to round to the nearest 10th. I look at the 3, and then so I'm not going to round it up. I'm just going to leave it at 4.3 tablespoons. Now you might be thinking in general, you might be like, well, what is that? You could find out how many teaspoons that is, and you could, get into the minutia as far as that's concerned. But for right now, that is an acceptable answer. So you don't need to worry about administering this. And my guess is that if it was an actual medication, they'd probably just round it up to 5, 5 tablespoons, or round it down to 4 tablespoons, depending on what they were doing. All right. And then the other thing is, if you want to dive into some of the practice, there's already some practice posted in the 110 folders, both for Allegheny campus and for Boyce. I think there's even some stuff for North and South campuses. So most of the 110 stuff is pretty consistent. There are some things that are a little bit different, and I'll try and organize that so it's a little bit more straightforward for your class. All right, let's look at another thing or another example let's do metric system. And let's say I'm going to go from, let's say I'm going from 50 milligrams, and I want to know how many, always hit the wrong button. I want to know how many grams that is. So I'll let you try this one again, Kelsey, and then let me know what you get. And again, I don't know is very acceptable at this point.
Is it 0.05 grams?
Good. I was afraid, because this happens a lot, students will take that, and you're right. So I would make sure you write 0.05. Most students are trained because that's a number less than 1. Okay, but you might want to round that to the nearest 10th. Don't do that. When it comes to metric conversions, when you're within the metric system, you do not round your answers. You leave them as they are. So if you get something that's like 0.275, that's your answer. If you get something that's, 0.075, that's your answer. Just leave it as it is. And then for practice purposes, now my guess is that you just move the decimal over. Is that correct?
Yeah, that's why I was wondering what the dimensional analysis would look like.
You got it.
Because sometimes I struggle when it gets kind of like micrograms to kilograms kind of thing.
So if we're making a conversion using dimensional analysis, we have milligrams to grams. And now we just have to remember, well, what is the conversion between grams and milligrams? 1 gram, 1,000 milligrams. And I'll give you a little bit of a heads up. It always seems to be 1,000, whether it's 1,000. So 1 microgram is 1,000. I'm sorry. 1 milligram is 1,000 micrograms. 1 gram is 1,000 milligrams. And those are the ones that you have to deal with. You won't see decigrams. You're not going to see nanograms. It's pretty much just grams, milligrams, micrograms. If I had changed this to 250 milligrams, then your answer of 0.25 would still be the correct answer. Again, don't round. Don't round your answers. Actually, just in case, because someone usually asks about this. So if I do, let's say I have 1,275, let's just say micrograms, and I want to know how many milligrams that is. Oops, helps if I.
Is that 1.275 and you would not round, or you would round?
You would not round.
Okay.
So you're exactly right. So your answer would be the 1.275 milligrams. And that's the thing that I try and get across is we definitely don't want to round when we're dealing with numbers that are where you're just doing a simple or straightforward metric to metric conversion. But the temptation is going to be to round, especially since we just spent that time earlier talking about the rounding rules. So
yeah, I can see getting like panicked in the test and then just thinking to round, and so that's a good call out. Thank you.
You're welcome. And it is a commonly missed thing, which is why I always I try and bring it up. So I think that's a good place to stop for today. And then we'll just kind of continue on with this on next Tuesday, and we'll see if we can get more people to come on. But I usually start getting emails and people asking questions, or somebody will tell me like, oh, can you meet at this time and day? And then unfortunately I have to tell them probably not, but I will see what I have available. If another day and time would work best for people. So
sounds good. Thank you for your time. This was super helpful. I appreciate it.
No, you're very welcome. I'm glad you found it helpful. And then I'll see you in class on Thursday.
Yeah, see you in class. Have a good rest of your week.
You too, Kelsey. See you.
Thanks. Bye.
Bye.